Good morning!
Good morning!
Hi guys, so today we are going to be going over medication safety. I hope that everyone had a great weekend, and I hope that you all watched the videos on Blackboard for lab today so that you're all prepared and that you also did your boarding passes. Alright, so on the screen I've displayed a list of the vocabulary words that you should familiarize yourself with for the exam. Those are definitely ones that might show up. Okay, so these are the objectives for today. We just have 3. The first one is by the end of the presentation, the learner will be able to identify the 7 rights and explain the reasoning for each. Second one, by the end of the presentation, the learner will be able to discuss the 5 main routes of administration and their importance. And the third one for today is by the end of the presentation, the learner will be able to identify the sources of medication, knowledge, and information, and their importance. Okay? Okay, so for the first objectives, we're going to go over the 7 rights of medication safety, and we're going to watch this video.
Hi there, my name is Charlotte. I'll be your nurse today. Can you just confirm your name and your date of birth for me, please?
My name is Jane Doe. My birthday is 9/22.
Okay, great. I'm just going to check your ID band here. All right, Jane, so it's so nice to meet you. So I'm here today just to give you some medication that has been prescribed to you by the doctor for your pain. So the first thing I'm going to do is make sure that I check the 5 rights of medication administration, just to make sure that we're doing everything properly and safely.
Sounds good.
All right, great. So the first thing I'm going to check is that I have the right patient. So your name is Jane, and that matches my medication order right here, so that's the right patient, which is great. And the next thing I'm going to do is check that we're going to be administering the medication through the right route. And so the doctor has prescribed this medication to be taken by mouth, and so I'm giving you a pill which is taken by mouth, so that's the right route. And then I'm confirming the right medication, and so the medication order says that I'm giving you some ibuprofen today, and that's what I've got right here, so that is the right medication. And then I'm also going to confirm the dose, so it says that on the medication order it should be 200 milligrams, and this right here is 200 milligrams, so that's the right dose. And then I'm also going to check the right time. So the last time you took this medication was at 12 o'clock earlier today, and it's now 4 p.m. And it says here that you can take the medication every 4 hours, so you are taking this at the right time, okay?
Okay.
So I'm going to give you this pill now. You can take it by mouth. So it would be very important that I make sure that the patient takes the medication by having her say ah, so I can check to make sure she's swallowed it. Great. And then I would do the correct documentation.
Okay, so I hope you all enjoyed that video. Do I have any questions? Yeah, Chloe?
What if my patient doesn't want to take their medication?
That is a great question. So, as you can see, the objective says 7 rights, and the video we just watched is 5. So the other 2 rights that the patient actually has is 1, the right to refuse, and the second is right documentation. So remember, if you didn't document it, it didn't happen, and it's very important to allow the patient the right to refuse and to always remember to document. Okay, so for the second objective, we're going to go over the 5 main routes that you're going to be administering the medication. The first one is per oral. For this one, it's very important to remember to never crush the enteric tablets. And the other ones are intramuscular. In the video, we'll be showing you the ventrogluteal site, which is the most commonly used one for adults, and other ones are intravenous, intradermal, and subcutaneous. Does anyone have any questions about the video we just watched or anything about the 5 routes? Chloe!
What if my patient can't swallow medication and they are prescribed PO?
That is a great question. That's actually on the next slide.
So let's imagine that Jane Doe can't swallow pills.
I can't take these by mouth. What should I do?
Okay, I'll call your provider and see if a different route of administration would be more appropriate.
What other routes are there?
Well, there are a lot of different routes of administration for medications. Some examples are intravenously, intramuscularly, intradermally, or subcutaneously, among others.
That sounds great.
So for our last objective today, we're going to go through the sources of medication knowledge. Based on what you guys have learned in Common Health, could you tell me a few sources that you've heard of so far? Yeah, Charlotte.
Up to date and clinical key.
Yeah, those are both really great sources. One of the ones that I really recommend for you guys to use is Micromedics. So this will show you pretty much any prescription medication that you would see on your patient data sheets, and it also actually has herbal medicines as well as vitamins, which are also really important to look at for interactions between two medications. One other really great source for you guys to take advantage of is going to be the hospital database, and you guys can actually use that to look up different medications as well as policies. Okay, so next I'm going to show you guys a video on how this would play out in the clinical setting.
Hey, I had a question about some medications for my patient. I'm not quite sure if they're compatible with each other. Where can I find some more information about this?
So, as nurses, we have a wealth of information available to us through the hospital online database, and it helps us gain knowledge about medication. And then Micromedics is a great source too. And it's really important to know things about different medications, like the routes of administration or the safety of administering medications, as well as checking the compatibility with each other, especially if you're administering multiple at once. So on Micromedics too, there are also patient education printouts, which can be really helpful. That's a great way to make sure that we stay up to date with all of the medication knowledge that we need to, so that we can practice best care.
All right, great. Thank you so much.
Yeah, of course.
So that video concludes class. If you guys have any questions, please feel free to email me or the TA, and just know that the discussion board is always open for questions. All right? I'm going to give you guys one joke before you leave today. All right, ready? If athletes get athlete's foot, what do elves get? Anyone? Mistletoes. All right, I hope you guys have a great Christmas break. That's it for today.